I'm Dr. Cinda Rushton, Professor of Clinical Ethics, Nursing and Pediatrics at Johns Hopkins University. We are in an unprecedented time that the COVID-19 virus has really created incredible array of ethical challenges that frontline nurses are confronting on a daily basis. It has called us to enlarge our ethical framework in ways that we have not had to do in the past. Our patient-centered ethical framework that focuses on individual patients, their needs and preferences and values, has really been the bedrock of our nursing practice. And now we are being asked to enlarge that ethical framework to include a public health perspective and to think more intentionally about how do we maximize the good for more people and minimize the harm so that people who are most likely to benefit will have the opportunity to access our scarce resources. And what's important is this isn't an either-or proposition. It's not that we're actually abandoning our patients, although it might feel like it at times. Sometimes feeling as if we're providing less than optimal care, that we're putting ourselves and our families at risk. And I think many of you feel helpless to meet the needs of so many people. The needs are really endless. And it's hard to make sense out of these situations. And I think we wonder, is it actually possible to accept what seems unacceptable with any degree of integrity? So the question, how do you balance your obligations to your individual patients with the needs of the broader population? For many nurses, and maybe you're one of them, may wonder, what part do I play in bringing about the best outcome for the most people? And how do I do that with integrity? It would be easy to use all of our energy to fight against the reality that we're in. But that may well leave us exhausted and unable to serve in any way. What we're actually being asked to do is to pause, to reflect, and to respond. So pausing may seem like a luxury in the chaos that we're in, and yet, unless we find ways to pause, to disrupt the patterns of fear and distraction, we're not likely to make the best decisions for our patients or for anyone in this context. So the very first thing is, how do we begin to notice how our nervous systems are being hijacked by fear and uncertainty and conflict, and how do we actually bring ourselves back to balance? One of those easy things that we can do is to use our breath. And as we think about just focusing on the breathing, inhaling and exhaling, we can begin to engage our parasympathetic nervous system in a way that helps to calm our nervous system to a place where we can actually perceive things clearly, where we can begin to really understand what the choices are that are in front of us. The second part is reflecting. And reflecting is a place that gives us place to pause and to really consider why we're here. And I know for myself, reorienting toward why I'm a nurse is both an anchor and a resource that we can use as we're trying to determine how to uphold our ethical obligations in the midst of this very uncertain territory. To be able to remember, why am I doing this work in the first place? What was it that brought me to my profession? And in the midst of all the chaos, it's going to take some discipline to be able to stay focused on what matters most. Reflecting also invites us to reflect on where our distress is coming from. Is it coming from that dissonance between what we think we ought to be doing and what we're actually doing? And that's causing us to experience moral distress, a sense of violation of our integrity. And it might be that we're feeling like we have to balance how I provide care for this patient in front of me and how I can take precautions to prevent the spread of this disease to other patients, to my family, to other people in my community. So this moral distress is real, and it's in many ways a signal of our awareness of threats to our integrity. And so using it as a tool to guide our attention to say something needs attention here, and to be able to bring those resources to that. The last piece is to respond rather than react, and to respond with compassion to ourselves, to our own limitations, and to the people that we're serving, to our colleagues, to our leaders. And for a moment, it might be worth just imagining, what is it that I can uniquely bring to this situation? And I would submit that as a nurse, you have been and are now the last thread of compassion for many patients. We're hearing stories of patients dying alone, people not having their families with them during illness. You already know how to respond and focus on the needs of the patient that's in front of you. And now it's time to actually honor and embrace our competence, the empathy that we bring to the moment, the skill, the wisdom, our commitment to fairness, the courage. All those things are part of your repertoire. And in many ways, even in a public health framework, the patient remains your anchor in the midst of chaos. Focusing your attention on your patient, the person in front of you, and to consider how to bring respect, compassion, and fairness is needed now more than ever. This is a time of invitation for us as nurses, for you to claim your ethical values in a new way, in this national and this global perspective, and to discern how you can bring the skills that you have as a nurse to these situations where very hard choices have to be made. To embrace the fact that nurses have the skills that are absolutely essential for being able to provide ethical care in this pandemic. As we enlarge our perspective, I invite you to go back and remember why you're a nurse, why your care, your competence, your skill, your knowledge, your compassion matters, so that you can live your values in a different way, and even perhaps an imperfect way. We have to really embrace and amplify the importance of what you are doing every day, every moment in the midst of this pandemic. There's nothing easy about what you are doing right now. The hard choices that you never thought you'd have to make, and yet you must. Integrity isn't about perfection. It is about being committed to living our values as best we can in an imperfect and unpredictable and chaotic world. So even recognizing when you're in integrity and out of integrity is important in this very challenging time. There will be moral residue. There will be unmet obligations. There will be the accumulation of unprocessed moral distress. And it's because we cannot meet the needs of everyone in the way we should. How we end up processing this moral residue will require our community to come together and to explore ways to heal from that moral residue. We are standing with you with gratitude and solidarity. And I would just want to offer a few phrases as support as you journey into this uncertain territory by an author who I have no idea who it is, but I found the words really important. You might want to use these a couple times a day. Strengthen me to see the wonder of my work through the eyes of those I serve. Enable me to serve others with respect, compassion, courage, and love. And let my work be a light to those in need and a beacon of hope for those who despair. Be the nurse you really are. Thank you for what you're doing every day, in every moment.